I'd like to talk about some body parts.
Sure.
One of the most common body parts that's injured in an athletic injury is the shoulder. And people understand the term rotator cuff tear. Not everybody understands what that is. It's probably one of the most common injuries, both with athletes and with non-athletes, in the shoulder. Why don't you take a moment and explain to us what a rotator cuff is and how it's repaired, how it's treated non-surgically, and then we'll talk about other parts of the shoulder.
Sure. So, simply put, the rotator cuff is a tendon that connects the muscles from your upper back to your shoulder. So, there are two groups of muscles that run the shoulder: the rotator cuff muscles, of which there are 4, and then this kind of muscle we think about, this meaty muscle on the outside of our shoulder, which is our deltoid. And those two muscle groups run our shoulder. So the rotator cuff tendon is the tendon which connects the muscles of the rotator cuff to the upper part of your arm. And it's called a cuff because it starts kind of in the 4 o'clock area, and then it goes all the way around to about the 7 o'clock point. And up at the top, between 10 o'clock and 2 o'clock, is where the rotator cuff commonly gets stressed and will at times tear. So there can be tears that occur suddenly, which is less common. The tears that occur gradually over time, sort of the way the knee of your pants wear out. You wear them long enough, and then one day you walk in the house and your spouse says, how'd you tear your pants? And you look down at your pants and you realize, oh shucks, they're torn. But when you take those pants off and you feel that fabric, you realize that fabric had got kind of thin, and then you just did the wrong thing at the right time, and now it's torn. And just like your pants, if you want to save those pants, you take them off right away and you take them to the seamstress or a tailor and you have them repaired. If you keep wearing those pants, that tear is going to get bigger. So that's why it's important to allow us to engage this problem early, because if that is what's going on, there are things that we can do to treat it without the problem getting so significant.
And without surgery.
And sometimes without surgery.
Right. So let's say you have a hole in your pants. What are the options, Dr. Seamstress, that you have to repair that hole in a knee?
And is that an example? Is that a shoulder?
This is, in fact, a shoulder. So these are the rotator cuff muscles. This is the supraspinatus muscle at the top.
Maybe we can zoom in on this too.
And then infraspinatus teres minor. And then there's one that is on this side that is not shown, that's on this flat underside of your shoulder blade, which is the 4th muscle. And all of these are coming this way and come around and connect to this bone right here. And that is why it's called a cuff, because it goes around from front to back.
Are the green things the tendons?
The red.
Or the red?
These are tendons.
So just to clarify, if I can do this backwards, or the screen's backwards for us, this is the ball and socket joint. This is the top of the upper arm here, called the humerus bone, and this is this shoulder blade. So you're looking as if the torso was removed, your body was removed, and this is the front of your shoulder blade. So the back of the body is aiming towards me. I'm looking at the back of this body. And so there's a muscle on the underside which comes around and wraps like this, and as it shortens like this, it takes this ball and socket joint and rotates it. The muscles that come from up top and attach here, as they shorten, it brings the arm in an up and outward direction. And then there's muscles on the back of the shoulder blade that wrap around this way, and as they rotate like in this direction, it'll take the arm and rotate it outwards like my arm is doing here in this direction. So they're simple little pulley systems that, by way they're attached to the scapula and or come from the scapula and attach to the humerus bone, they can rotate the shoulder in multiple directions. And when you blend those directions, you can put your arm in any position. And where they come together to cap over the shoulder, that's the rotator cuff. Fair enough explanation?
Absolutely.
So the most common areas of torn, I think you told us, were in this area right up here.
10 o'clock to 2 o'clock, yes.
Right. So pretty much if I hold it from the side, right underneath of my fingers. And if it tears, the tendon retracts back and you lose the ability to rotate your shoulder.
Is there a lot of pain associated with it?
Typically, yes. Most people know they've done something because as Dr. Perlow was showing, the shoulder joint, the cup is very shallow. The cup is really only about as shallow as the palm of your hand. And so the ball is balanced there. And these 4 muscles that contribute to the rotator cuff are pulling in a balanced manner, balancing the ball in the cup. When one of those is not pulling in the same manner, the ball stops being balanced. And then that affects the function of the shoulder. So it's like you had 4 horses pulling a cart. If the horses are equally strong, the cart goes straight. If one horse is lame, then the cart's not going to pull equally up the road. So once that balance is off, people develop alternative mechanisms to try and move their arm the way they want. Because really the shoulder's function is to place your hand where it needs to be in space to do what you want it to do. Mm-hmm. So when it can't do that, it tries to recruit other muscles and other things to help do that, and that completely affects the balance and changes, stresses other muscle groups, and that's why many times people come in and their neck hurts and their upper back hurts, and those we call those compensative mechanisms.